So the next step is absolutely critical, and you taught me that many years ago, is the hemostasis. And this is wetfield cautery, so you've got a fine tip forceps, and my assistant is just dripping the fluid drop by drop, so you get a nice wetfield cautery. You're avoiding charring the tissue, so if you have too much charred tissue, potentially get post-op inflammatory response and increased scarring and increased risk of blood failure. So if you can minimize the amount of charred tissue on your scleral bed, it's much better for reducing post-operative inflammation.
I think, again, I'd concur exactly with that. And for the diathermy check, my mantra is check, check, and check again. And so, I make sure at the start of the case that the diathermy forceps are meeting, and that the diathermy machine is set on the lowest possible settings. And again, just before I use it, I check that again, because scleral shrinkage or scleral melting is your biggest problem downstream of the main surgery. And like you, I do everything possible. I'd rather do it so gently that I'd come back to it a minute or two later, rather than char or shrink the tissue, particularly in the younger patients where the tissue tends to shrink a bit anyway. You cannot afford, or the high myopes with thin tissue, you cannot afford to have scleral shrinkage.
Yeah, I find that on the diathermy, on the phaco machine, I'm using about 20, and if you don't check the settings, more than likely it's on a setting of 30, and as soon as you touch that sclera, you can see it burning away and charring, and all of a sudden you realize, oh, I have to turn the diathermy down. So yeah, it's so important to check that setting before you even start. On occasion, they haven't had the fine tip forceps diathermy, and they've given me a pencil eraser, and it actually does work quite effectively, and provided you do it wet field, very gently on that around 20 setting, it can also be a useful way to diathermy, I found. Not quite as exacting.
Yeah, no, I think that's right. It's the one part of the operation where I insist on consistency.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.